health and medical community have been calling climate change the biggest threat to global public health this century. So it was first described as such in The Lancet, the International Medical Journal, in 2009. And it's something that the World Health Organization really firmly and stridently communicates, that this is the biggest threat to global health this century and possibly forever. Much bigger impact than COVID. It threatens our very existence as a species if we don't act quickly. Some of the ways in which climate change impacts our health, I think one of the easiest ways to kind of understand is through the impact of extreme weather events, bushfires. You know, people in Australia are well familiar with the impact of the mega fires that we had in 2019 and 2020. So not only just the impact of being in those fires themselves, whether it leads to a loss of life or loss of livelihood and people being displaced, but also the air pollution that blanketed much of Australia for many, many weeks. On several occasions, Australian cities had the worst air pollution on the planet related to those bushfires. So that was huge. And then there's kind of violent storms and flooding, people's homes inundated, not only drownings, but also, waste, chemicals, sewerage pouring into floodwaters can, be a huge threat to health. And then heat waves, something we're very familiar with in Australia, and people tend to dismiss because Australia does get hot. But what people don't tend to appreciate is that we can very quickly, as individuals, be overwhelmed by heat stress. And, anybody is vulnerable to that, but particularly people who are elderly, children, people who are working outdoors, farmers, people who are working in indoor environments that are not well cooled. So, there's a lot of risks for health, but there's lots of opportunities as well. So burning fossil fuels is a huge source of air pollution. Air pollution kills about 7 million people each year prematurely. In Australia, it kills about 3,000 people prematurely each year. It costs us about $16 billion in healthcare costs. So there's an opportunity for us in avoiding the burning of fossil fuels, which is, responsible for a lot of air pollution, particularly in our cities, and diesel for cars. So if we can avoid that, we can help tackle climate change and reduce those deaths. So, with clean powered energy and transport, and active transport, getting people walking, cycling and so on, we can not only reduce emissions, but improve people's health at the same time.
No, excellent. Thank you. I think you've given us a really good snapshot of the background and the why and why we need some action. I might just change tack a bit now, and I guess just off the back of COP26 and so forth, get the views of the whole panel on, Australia's current net zero ambitions. We've also got a question from the audience here around the top 3 priority areas to lower carbon footprint. So while we talk about that, though, I might just put up a bit of a poll question for the audience, and just if everyone could just have a think about what the emissions reduction targets their organisations have. We've got a couple of options there. That'll stay up for a moment. To the panel, can I get your views on, Australia's net zero ambitions? Fiona, again, I might just let you lead off, and then we'll move through everyone else.
Yeah, well, COP26, and a very important conversation. Health was much more prominent at this COP than ever before. The UK government, as the COP26 president, had health as a COP priority and developed what they called the COP26 Health Programme, actually with our international partner, Healthcare Without Harm and World Health Organization. And that was an opportunity for health ministries around the world, national and subnational, to make pledges towards climate adaptation and resilience and low carbon and sustainable healthcare. So the good news coming out of that is over 50 countries have pledged to decarbonise their health services and to support climate adaptation and resilience to protect health. So that is a good outcome. Health was not as prominent in the outcome text, though. And in fact, I think it's been removed. So that is a really disappointing outcome because it should be prominent. It is really our rationale for tackling climate change. We want to stay alive. That's really critical. All states and territories have net zero by 2050 commitments. So in fact, every state and territory in Australia could make a pledge under that COP26 health program, which actually continues all the way to COP27, where we hope it will be rolled over. So the fact that we haven't had a pledge or a commitment from an Australian government yet doesn't mean that we won't get one. And we actually were involved in helping to host a round table for Australian health ministries ahead of COP26 to make them aware of this program. And we hope that commitments will come. The federal government, however, really doesn't have policies or plans to achieve net zero. The current plan I would describe as fanciful. It's based on technologies that don't exist. And the truth of the matter is that this government, the federal government, is not serious about this issue. The emissions reductions that we achieved, I don't know if anybody's seen a recent Climate Works report, shows that actually any emissions reductions that we're achieving in Australia at the moment is due to domestic action, people putting solar on roofs, or state and territory policies, not actually related to federal government policies. So a lot more to do there.
Excellent. So I'll put the same question to yourself, Emily.